Here are the most common side effects when taking Trazodone. From most common to least common: dry mouth, headache, dizziness, sleepiness, nausea, feeling nervous, so anxiety, blurred vision, and these are all less than 10%, constipation, trouble sleeping. That's unusual because Trazodone is used to help people with sleep, diarrhea, confusion, bad dreams, or backache. I thought that was unusual as well. Here are some of the rare but serious side effects of Trazodone. Priapism, which means you get an erection that doesn't go away for many, many hours, and it's a medical emergency. It happens in about 0.016% of men. So a very rare risk, but still a risk. Seizures, mania, and that means if you're already predisposed to mania, you have the genes of bipolar disorder, this may flip you into a manic episode. And suicidal thoughts in people younger than 25 years old. I made a video all about suicidal thoughts. I'll put that on screen here. You can check that out if interested. And this suicidal thought warning is the same for any psychiatric medicine that you take. So who can't take Trazodone? Well, if you have an allergy to Trazodone, you can't take it. Or if you've taken an MAOI in the past 2 weeks. MAOI is monoamine oxidase inhibitor. It's an older form of antidepressants that doesn't play nice with other antidepressants. So how does Trazodone work? Well, it has a very complex mechanism. It's known as a SARI, a serotonin agonist reuptake inhibitor. Let's take a look at what that means. Well, it's a selective serotonin reuptake inhibitor, and it also blocks 5-HT2A, 2C, and 7. 5-HT just means serotonin, so it blocks these serotonin receptors. How it mainly works, where it works the strongest, is on the SSRI, so the serotonin reuptake pump, and it works at the 5-HT2A receptor, and it blocks that. Those are the two biggest ones. But it has many other mechanisms as well. It blocks 5-HT2B and 1D. Not really sure how helpful that is in the literature. It also blocks alpha 1 and 2 adrenergic receptors, which can sometimes cause dizziness or orthostatic hypotension, which means you get up too fast and your blood pressure drops and then you get very dizzy. And it also blocks histamine receptors, H1. That's how Trazodone works to help with sleep. Well, what is Trazodone used for? Well, there's an FDA approval for major depressive disorder, but that's about it. It's used off-label for sleep and anxiety as well. Here's how Trazodone is dosed. When we're dosing it for major depressive disorder, we start at 75 milligrams twice daily, and we increase by 50 milligrams every 3 to 4 days. That is a very aggressive increase regimen. Normally, we make increases a bit slower in the office setting, usually about every 2 to 6 weeks, if needed. And the max dose of Trazodone is 400 milligrams a day in the office setting. When we're using this for sleep, the dosing is a little different. We can go a lot slower. We start at 25 to 50 milligrams at bedtime, and we increase by 20 to 50 milligrams nightly because the antidepressant effects of Trazodone take 2 to 4 weeks for it to work, but the histamine blocking works basically immediately. And the max dose when used for sleep is generally no more than 150 to 200 milligrams nightly. So how fast does Trazodone start working, and what do we need to monitor? Well, in depression, it starts working in about 2 to 4 weeks. That's standard with most antidepressants. Compare that to sleep, and it works immediately the same night. And what do we need to monitor? Well, nothing if you're a healthy person. Here are some of the pluses and minuses of using Trazodone. It doesn't cause any weight gain. It has no to very little sexual dysfunction, meaning low sex drive, difficulty with orgasm, difficulty with erection, low arousal. It's very good for helping with sleep. Of course, you do need to take it twice daily when used for depression. So that's a negative. It can be inconvenient sometimes, and it can cause day sleepiness. That's sometimes the one limitation of using Trazodone in most people. It just makes them too sleepy during the day. Otherwise, it works very well. If you enjoyed this video, check out this video on screen now on Auvelity, a newer antidepressant, which combines a cough syrup, dextromethorphan, plus bupropion, an antidepressant, combines them together, and it works very well. Check it out in the video. I'll see you there.